All right, I'm not going to pretend that I know or fully understand the changes that occur in a woman's body. That's why our next expert is in studio to not only help you out, but help me out. We're talking about Dr. Brandy R. Patterson. She's with Brookwood Women's Health and also at Brookwood Baptist Hospital. How are you doing?
Doing well.
We're talking about the menopausal transition, right?
That is correct.
Okay, so I first got to ask, and I do know, what is menopause, though, for everybody?
So menopause is slightly misunderstood. The actual term menopause means cessation of menstrual cycle for at least a year and cessation of natural ovarian function. It's the getting to that point that's the hard road.
When does this normally occur?
So normally women will start to experience some of those symptoms of the perimenopausal transition around age 45 to 55.
Okay, are there any type of symptoms that that women need to be looking out for?
Sure, so that's the biggest issue is there's such a huge myriad of symptoms, which you can see on your screen now, everything from weight changes to hair changes, nail changes, hot flashes, night sweats, libido changes, sleep trouble, just to name a few.
Right. Now, this is something that I did learn about when I was doing the research in you coming in studio, that the transition to menopause involves two parts. Tell us what those two parts are and then explain them.
Okay, so the two parts are, again, the perimenopause state, so the transition from just normal ovarian function as you begin that decline in ovarian function to the actual postmenopausal state, which is once you've been through that year of no cycles or no ovarian function. So it's kind of like you've hit the finish line and you're at the end, if you will.
Right, and are there therapy options that can help women out during this time and phase?
So there are, and I think that's the biggest thing that's missed is women just think, oh, it's natural, this is something I just have to go through, I'm just going to suffer. But there are lots of different therapy modalities and options that women can use depending on which symptomatology that they have. So it's not just a suck in a deep breath and suffer anymore. There are lots of options for management.
What are there?
So everything from classic hormonal therapy, which a lot of people know about, that can be, depending on a woman's natural history and risk factors, might be an option for her. But there are natural remedies, natural options, from vitamins to food changes, dietary changes, exercise. There are just lots and lots of options that women can look into.
And no single woman's transition are the same, really. They're similar, but they're not identical.
Correct. So just because your best friend has symptoms A and B, you may be all the way down at X, Y, and Z, doesn't mean it's not both the perimenopausal transition. We are all such unique human beings that we need our therapy and our plans to be unique as well.
And you say talk it over with your doctor about the type of options for you and to see what works best for you?
Absolutely.
And where can they do that at your place?
So we would love to see you at Brookwood Women's Health. So please give us a call to your GYN. Just don't suffer.
There you go. Dr. Brandy Patterson, thanks so much for joining us.
Thank you for having me.
I feel comfortable about that topic, by the way. I appreciate it. Thanks so much for the help. And we've got plenty more coming your way with another half hour of WBRC 6 News right here at noon.